There's a moment most people don't think twice about. You're reading something, a menu, a text message, maybe the television across the room, and for just a second, something looks off. The edge of a word blurs. A face looks slightly wrong. You blink, it passes, and you move on, assuming it was tiredness, or the light, or maybe you just need new glasses. That moment, the one you forgot about by the time you poured your next cup of coffee, may have been the most important warning your body has ever sent you. I've been practicing medicine for a long time. I've worked with patients across decades of their lives, and I can tell you, not theoretically, but from sitting across from people in rooms that felt very quiet, that the ones who dismiss brief, passing visual disturbances are often the same ones who call me weeks later from an emergency room, or don't call at all because someone else is making that call for them. Blurry vision is not always about your eyes. That's the part almost nobody tells you clearly enough. And if you're over 50, that distinction isn't just medically interesting. It may be the thing that saves your life. Your brain receives blood through an intricate system of vessels, some no wider than a human hair. When that supply is interrupted, even briefly, even partially, things go wrong fast. The visual cortex sits at the back of your brain, and it is extraordinarily sensitive to changes in blood flow. What you experience as blurred vision, double images, a loss of part of your visual field, or a sudden darkening in one eye, that can be your brain sending a distress signal, not your eye, your brain. The term doctors use for what happens before a major stroke is TIA, transient ischemic attack. Transient. It passes. It feels like nothing. In fact, that's the most dangerous thing about it. It feels like nothing serious happened. Blood flow was briefly cut off somewhere in the brain. The body compensated, and symptoms disappeared, sometimes within minutes. People drive home from work after TIAs. They make dinner. They go to bed. And a significant number of them wake up to a full stroke within the next 48 hours. Or they don't wake up at all. Visual disturbance is one of the most frequently overlooked TIA symptoms, especially in people over 50. And I say overlooked, not because people are careless, but because we have been culturally trained to dismiss things that go away on their own. If it's gone, it wasn't serious. That is a deeply dangerous way to interpret your body, particularly as you age. After 50, the cardiovascular landscape changes. Arterial walls that have spent decades moving blood begin to thicken slightly, to stiffen, to accumulate deposits in ways that narrow the internal passage. The heart itself may begin generating rhythms it never produced before. And some of those rhythms, particularly atrial fibrillation, create conditions where small clots can form and travel upward into the brain with stunning speed and without any warning. None of this announces itself. None of it hurts. It simply happens silently over years, until one moment when the system narrows just far enough that something briefly breaks through. What you feel in that moment might be almost nothing. A slight smearing of letters on a page, a heaviness behind one eye, light that seems too bright on one side, a face that looks strangely flat or hard to focus on. These are not symptoms people typically describe as frightening in the moment. They describe them as strange, brief, slightly annoying. If any of that sounds familiar to you, not necessarily something happening right now, but something you remember from the last few weeks or months and quietly filed away. I want you to stay with me here for a moment, because what I'm about to explain is not something most people get told until it's too late to matter. The visual pathway in your brain is one of the most complex neurological systems in your body. When you look at something, signals travel from your retinas through the optic nerves, cross at a junction near the base of your brain, and then travel backward to the visual cortex. That path passes through or alongside multiple critical vascular territories. A small clot, a momentary pressure change, a vessel in mild spasm, any of these can disrupt signal transmission at any point along that route. And what you experience on the conscious end of that disruption depends on exactly where the interruption happens. If it's mere the optic chiasm, you might lose part of your visual field. A quadrant goes dark or vague. If it's further back in the occipital lobe, both eyes may be affected simultaneously on the same side, which is something people often describe as one eye blurring, when in reality, both eyes are missing the same half of what they're looking at. If it's more toward the front of the visual processing chain, you might experience what feels like a curtain being drawn across one eye, which has a specific name, amaurosis fugax, and which every doctor learns to treat as a medical emergency, because the artery feeding that eye comes directly off the carotid, and carotid trouble is stroke territory. The reason I'm being this specific is because vague warnings don't move people. Blurry vision can be serious. You've heard that. You've seen it on health websites, probably scrolled past it. But when you understand that what's happening is not your lens misfocusing, but your brain being briefly strangled of oxygen in a region so specific it affects only how light on your left side is processed, that's different. That should feel different. If you've been watching this channel for a while, and you understand what I try to do here, you already know that my goal is not to frighten you without reason. It's to give you the kind of specific, honest information that allows you to make better decisions. The kind of information that means you walk into a conversation with your doctor carrying something concrete, not just a vague worry. If this resonates with you, if you've had any of these passing moments of visual strangeness, and you want to understand more of what your body may be trying to communicate, hit subscribe and leave notifications on. What we cover on this channel is designed for people who are paying attention to their health before a crisis happens. That's a different kind of person. That's a more informed kind of person. That's probably you. Now, there's something specific about the timing of these episodes that most people don't know, and it matters in a way that will probably change how you track your own symptoms going forward. The medical understanding of TIA risk windows has shifted significantly in the last decade. What used to be described as a minor, temporary event with low follow-up risk is now understood very differently. Studies following patients who experienced TIAs showed that the days immediately following an episode carry dramatically elevated stroke risk, and the risk is highest within the first 48 hours. But here's what's almost never communicated clearly to patients. The risk doesn't just exist in those 2 days and then evaporate. There's a sustained elevation in vulnerability that can persist for weeks, tied to whatever underlying condition created the first event in the first place. Which means that if your blood pressure is chronically elevated and a small vessel in your visual cortex briefly spasmed 6 weeks ago, the conditions that caused that spasm are still there. If you have early atrial fibrillation and a clot formed, traveled, briefly blocked a vessel, and then dissolved, the rhythm that created it hasn't been corrected. The body's ability to temporarily recover from these events is remarkable. It is also deeply misleading, because recovery and resolution are not the same thing. This is something I see in practice more than almost anything else in older patients. The body compensates. The compensation is so effective, so seamless, that the person in front of me genuinely cannot believe that anything serious happened. They feel fine. They look fine. Their cognition is intact. And I'm looking at an MRI that shows small areas of the brain where tissue has already been silently damaged, what we call white matter changes or small infarcts. And the patient is telling me they haven't noticed anything unusual except that their vision went a little strange about a month ago, just for a second. And they figured it was because they haven't slept well. I don't tell you this to make you feel like your body has been betraying you without your knowledge. I tell you this because understanding the gap between how the brain feels and what is actually happening inside it is one of the most important things a person over 50 can internalize. You cannot feel a small stroke. You cannot feel early white matter disease. You can feel the downstream effects. The moments of blur, the slight word-finding hesitation that you chalk up to stress, the brief episode of imbalance on the stairs that you attributed to moving too fast. But those feelings are the outermost signal of something deeper. And by the time those signals appear, the process has often been underway for a long time. Cholesterol, and I want to explain this in a way that actually sticks, not the way it usually gets summarized, isn't just about numbers on a lab panel. The problem isn't cholesterol circulating in your blood. The problem is what happens when certain forms of it, particularly small, dense particles of LDL, penetrate the inner wall of an artery and trigger an inflammatory response. The body tries to handle it. Immune cells rush in. A plaque begins to form. That plaque is not a uniform, stable structure. It's more like a pocket of material under the arterial wall, covered by a thin cap of tissue. When that cap ruptures, the contents of the plaque are suddenly exposed to flowing blood, and the blood clots immediately around it. That clot can block the artery entirely, or it can break off in a fragment, travel upward, and lodge somewhere in the brain. That is what a clot-related stroke is. That is what a TIA is, when the fragment is small enough that blood flow restores before permanent damage occurs. And the vessel most directly associated with visual TIA symptoms, the carotid artery, is also one of the most common sites for this kind of plaque formation. It runs up the side of your neck. You can sometimes feel your own pulse there. And inside it, in someone who has spent decades with slightly elevated blood pressure and cholesterol that was never quite addressed, there may be a plaque that has been quietly building for 15 years. I want to ask you something directly, because it matters for this conversation. When did you last have your carotid arteries checked? Not a general physical, not a blood pressure reading, an actual assessment, ultrasound, imaging, that looked at the structural health of those vessels. For most people watching this right now, the answer is never, because unless you've already had a neurological event, most routine care doesn't include it. And yet the information that imaging could provide, the presence of plaque, the degree of narrowing, the texture of whatever's building there, could change the entire conversation about your personal risk in a way that no blood panel fully captures. The visual system is one of the few places in the body where what's happening inside your vascular network becomes directly perceptible. Your arteries are not visible from the outside. You can't feel them deteriorating. But the retina, the thin layer at the back of your eye that receives light and sends signals to the brain, is actually brain tissue. It developed from the same embryonic tissue as the central nervous system, and the tiny vessels supplying it are structurally similar to the vessels inside the brain itself. A skilled ophthalmologist or neurologist looking at the back of your eye is, in a very real sense, looking at a window into your cerebrovascular health. Amaurosis fugax, that curtain drop sensation in one eye, is caused by a temporary loss of blood flow to the retina, almost always from a small clot or debris coming off a diseased carotid artery. It typically lasts seconds to a few minutes. It is painless. It clears completely. And it carries a stroke risk that in certain studies has been measured as high as 10 to 15% within the subsequent 90 days, if not addressed. That is an extraordinary number for a symptom that feels like nothing. But it's not just the dramatic curtain fall that matters. Subtler visual changes deserve attention too, and these are the ones I worry about most, because they're easy to normalize. A slight graying of central vision in one eye. The sense that colors look a little washed out on one side. A brief episode where reading felt harder than usual and then resolved. Letters that seemed to vibrate or shift slightly before settling back. None of these would typically prompt someone to call a doctor. Most people file them under getting older or probably need a stronger prescription. And sometimes they're right about that. But sometimes they're wrong in a way that matters enormously. The conversation I have with patients about risk factors for cerebrovascular disease is one of the more uncomfortable ones in medicine, not because the information is complicated, but because so many of the contributing factors are things people already know about themselves and have been managing or not managing for years. Blood pressure, blood sugar, cholesterol, weight, sleep quality, physical activity, alcohol, smoking history. These are not mysterious variables. And when someone sits in my office and I explain that the combination of several partially managed risk factors over 20 years creates a cumulative vascular burden that their momentary visual episode may be reflecting, there's often a long pause before they respond. That pause usually contains a lot. Sometimes it's recognition. Sometimes it's a kind of quiet grief about choices that felt small at the time. Sometimes it's just the weight of understanding something that was always true but never quite landed before. If that resonates with you in any way, whether it's curiosity or recognition or something that feels uncomfortably close to your own history, I'd like to know. Leave a comment below and tell me, have you ever had one of these brief visual episodes and dismissed it? You don't have to share more than you're comfortable with, but those comments help me understand what the people watching this channel actually need to hear, and they help others watching realize they're not alone in something they've been quietly carrying. There's also a category of visual disturbance that is less acutely dangerous, but still worth understanding deeply. The relationship between the vertebrobasilar system and what some people describe as dizzy vision, or visual disturbance that accompanies head movements. The vertebral arteries run up through the cervical vertebrae, the bones of your neck, and supply blood to the back of the brain, including the cerebellum and the brainstem. Certain neck positions, or rapid head movements, can temporarily compress or kink these arteries in people who have underlying vascular disease or structural changes from years of wear. The result is a brief positional visual disturbance, sometimes with nausea, sometimes with a feeling of floating or instability, that clears within seconds of adjusting position. This is called vertebrobasilar insufficiency, and it's more common in people over 60 than most realize. It's often misdiagnosed as vestibular dysfunction or inner ear issues, or simply attributed to aging. The symptoms overlap enough that it takes a careful history to distinguish them. But the vascular component is important to identify because the vertebrobasilar territory supplies critical brain structures, and insufficiency in that system carries its own stroke risk profile, one that's sometimes underappreciated relative to the more well-known carotid pathway. What I want you to understand is that the geography of your brain's blood supply is complex, and the symptoms that arise when any part of that supply is compromised are often subtle, brief, and easy to explain away. The body is extraordinarily good at compensation. It reroutes, it adjusts, it maintains function through alternative pathways while the primary pathway is compromised. That resilience is remarkable. It's also why so many people arrive at a major neurological event without ever having had what felt like an obvious warning. Because the warnings were there. They were just quiet, they were just brief, and nobody told them clearly enough what quiet and brief could mean. The other dimension of this that doesn't get discussed often enough is sleep. Specifically, the relationship between sleep-disordered breathing and cerebrovascular risk. Obstructive sleep apnea, which affects a substantial portion of adults over 50 and goes undiagnosed in the majority of cases, causes repeated episodes of oxygen desaturation throughout the night. Each time breathing is obstructed and oxygen drops, the cardiovascular system responds with a surge in blood pressure. The heart works harder. The vessels experience repeated stress. Over time, this chronic nocturnal pattern contributes to arterial stiffening, plaque development, and increased risk of both atrial fibrillation and stroke. And the visual system, again, is sometimes where this shows up first. Morning episodes of blurred vision that clear after being awake for a while. Headaches on waking that people attribute to poor sleep without connecting them to what's happening to their vascular system overnight. A subtle cognitive cloudiness in the first hours of the day that lifts by mid-morning. These patterns are worth noticing, not in isolation, but as part of a larger picture that includes asking whether your sleep is actually restorative, or whether you're spending hours each night in a state of quiet cardiovascular stress. If you snore heavily, if you wake feeling unrested despite adequate time in bed, if you've been told you stop breathing during sleep, Or if you sleep alone and have no idea whether any of this applies to you, it may be worth asking your doctor about a sleep study. It's one of the most underutilized diagnostic tools in preventive medicine for people in this age group, and the downstream effects of untreated sleep apnea on brain health are more significant than most people understand. I want to come back to something I touched on earlier, because I think it's one of the most important practical points in everything we've covered: the concept of the observation window. When something unusual happens with your vision, you have a narrow period of time during which acting on that observation can meaningfully change your outcome. Not weeks, days, in some cases hours. This doesn't mean living in a state of panic about every visual fluctuation. Migraine with aura causes complex visual disturbances that are dramatic, but not typically stroke-related. Sudden changes in blood sugar can transiently affect vision. There are benign explanations that are far more common than strokes. But the way to distinguish between a benign explanation and a dangerous one is not to wait and see if it comes back. It's to be evaluated when symptoms are present or recent, because that's when the brain and vascular imaging tell the clearest story. Emergency rooms are equipped to do this. A rapid neurological evaluation, a CT scan, an MRI, a carotid ultrasound, these can all be done quickly when you present with a recent visual symptom and a concern about stroke. What I see in practice is that people often wait until a second or third episode before seeking evaluation. And statistically, that second episode may not resolve the way the first one did. You are not being alarmist by going to an emergency room after a brief visual disturbance that has no obvious explanation. You are being medically rational. The cost of going in when it turns out to be nothing, some embarrassment, some time, is categorically different from the cost of not going in when it is something. These are not equivalent risks, and too many people treat them as if they are. The other thing I want to leave you with is the importance of becoming a more precise observer of your own body. Not anxious, precise. There is a meaningful difference between hypervigilance about every sensation and the calibrated attention that comes from understanding what your body's warning systems actually look like. Most people over 50 have never been taught what the prodromal signs of stroke actually feel like from the inside. What a TIA actually is, why it passes, what it means when it does. They've seen stroke awareness campaigns. They know the word. But the granular understanding that would allow them to recognize their own experience as potentially relevant, that education is largely absent. The goal of everything I do here is to fill that gap. Not to create fear, but to replace vague anxiety with specific knowledge. Because specific knowledge is actionable, and vague fear is just uncomfortable noise. When you understand that a 20-second visual disturbance in your left eye that resolved completely could be amaurosis fugax related to carotid plaque, you know what question to ask your doctor. When you understand that the mild morning headache and word-finding difficulty you've been having might be related to overnight oxygen desaturation from undiagnosed sleep apnea, you know what test to request. That knowledge changes the conversation. It changes the outcome, and that is why it matters. As something that will change the specific trajectory of a specific person's health, maybe yours. If someone in your life is over 50 and dismisses visual episodes the way most people do, automatically, quietly, without follow-up, consider sending this to them, not as a warning, not as alarm, but as information. The kind of information that at the right moment can make a difference that no medication can make after the fact. Because the most effective stroke prevention isn't a drug. It's the moment someone understands what their body was trying to tell them early enough to do something about it. That moment can come now. For you, it can come now. Pay attention to what your body shows you, even when it's quiet. Especially when it's quiet.